Good morning, good afternoon, good evening from wherever you're joining us. Welcome to this webinar, The Future of HIV Control in Africa, Financing, Policy, and Resilience. It is a pleasure to welcome you to this webinar. It's the fourth and concluding webinar in the Africa-led HIV Control Working Group's 2026 Financing, Policy, and Resilience series. My name is Florence Riako-Anam. I'm one of the two co-executive directors at the Global Network of People Living with HIV, GMP+, and I'm honored to moderate today's session. A little housekeeping as we start. We have translation. First of all, please mute your audio for the smooth working of the sessions. Ensure that you have your reflections and engaging with us via chat. The Q&A section is also open, and we will address the questions you have if you put them there. Please use it. There's a recording for this session, and we will be sharing this recording afterwards. And if you need any support or technical issues within this call, please do let us know on the chat or on the Q&A section. Next slide. There are live captions available. To enable the live captions, click Show Captions at the bottom of your Zoom screen and select your preferred language. If you do not see the closed caption or CC button, click on the More options, the three dots on the corner of your screen, and then select Captions, and then follow the instructions on your screen throughout the webinar. Next. Now, it's an honor to present our speakers today. A very rich group of leaders are joining us for this session. We have Dr. Michelle Sidibe joining us. Today, we have Dr. Angeli Achrekar from UNAIDS joining us. We have Dr. Alex Coutinho also joining us, even though not on the photo here, and Brendan Kwesiga from UNICEF. So the agenda is going to look like this. We will have a set of questions for Dr. Angeli and Dr. Brendan to respond to, and then we will have a moderated panel Q&A questions with my questions preset for them, but also questions that will come from you, the participants. So please share them on our Q&A or on the chat. And then afterwards, we will have a leadership conversation with Dr. Michelle Sidibe and Dr. Alex Coutinho. We hope to have the webinar run and for 90 minutes, so please stay with us to the end. Before we start, we will have a Mentimeter exercise, I believe, yes, which you can scan the code on the screen. We will be asking you a simple question at the start and then a couple of them at the end, please. And I will pass over to Joan to lead us in this session. Yes, go ahead.
Please scan the QR code or go to menti.com and enter the code below. We'd like to invite you to take part in the first question of our poll. All right. In one or two words, what is the biggest challenge facing the future of HIV control in Africa? Florence, please read out the responses that come in.
I see limited focus on prevention, complacency, Africa ownership, financing. Please keep lack of ownership. Please keep your responses coming through. Financing is taking a big portion of your responses. poverty and financial, it's not completed, domestic financing. Please stay muted. Okay. Dependence on donors. Indeed. Thank you so much for filling in your thoughts on the question. And we will quickly move to basically what the series has been about. So, colleagues, we meet at a very important moment for the global HIV response. The landscape is changing rapidly, development assistance is evolving, countries are navigating significant fiscal pressure, scientific advances continue to create new opportunities for prevention and treatment. At the same time, expectations for country ownership and Africa leadership have never been greater. These shifts raise an important question. What will it take to sustain the progress of the HIV response while ensuring that Africa increasingly shapes its own future? Today's discussion is an opportunity to explore that question. Why this matters now? I like to bring up people living with HIV perspective in every discussion, so please bear with me. We have always spoken about the unfinished business of the HIV response. The cost of inaction is huge because people newly acquire HIV. 1/3 of a country's population of people living with HIV continues to have advanced HIV disease, and many people die from AIDS, largely from preventable and treatable diseases. As we continue to prepare for AIDS 2026, governments, regional institutions, multilateral organizations, civil society, and communities are considering how best to protect the gains made over the past decades while preparing for the future. So this is not just a conversation about financing, nor is it solely about institutions. It's about leadership. It's about partnership. It's about ensuring that the future HIV responses are increasingly driven by African priorities, African institutions, and African solutions. Today's discussion will explore these three themes: the future of the global HIV architecture and its implication for Africa, financing the next chapter of the HIV response through stronger domestic investments, innovative financing, community leadership, and sustainable partnerships, the leadership required to ensure Africa not only responds to change, but leads in shaping the future of the global HIV response. We are privileged today to be joined by distinguished leaders who I have introduced in the opening. They come from the United Nations, international organizations, and Africa leadership. They bring decades of expertise in global health, HIV policy, and financing and systems leadership. And we really look forward to thought-provoking, forward-looking discussions. Our first speaker is a dear friend, and she will help us understand how the global HIV landscape is evolving and what these changes mean for countries across Africa. Please join me now in welcoming Dr. Angeli Achrekar, the Deputy Executive Director at UNAIDS and Assistant Secretary General of the United Nations. Angeli, I pause here to thank you and the UNAIDS for your steadfast leadership during the high-level meeting on HIV and AIDS and the adoption of the 2026 UN Political Declaration in June on HIV and AIDS that happened in June. Today, you will open the discussion with the future of the global HIV architecture, exploring how the evolving multilateral landscape is shaping the HIV response and the opportunities for stronger Africa leadership, country ownership, and sustainable partnerships. Welcome, Angeli.
Great. Thank you. Thank you so much, dear Florence and colleagues, friends from all over. It's great to be together today. I first want to thank the Africa HIV Control Working Group. You really do play such an important voice in bringing African leadership vision and ideas forward in the HIV response at a time of major change in the entire HIV response. And so, first, I wanted to start by thanking the working group. Let me begin by saying first how proud I am of the pathway to sovereignty that so many African countries are charting today in the most difficult circumstances. I speak to you today. I have the privilege of speaking with you today as our executive director, Winnie Byanyima, is speaking at the Africa Union Summit hosted by the Ghanaian government, leading the advance towards health sovereignty. I think collectively we must never forget that more than 12 million people died of AIDS in Africa before the price of antiretrovirals came down and treatment finally reached all those who needed it. It took a massive global effort. It took massive partnership. It took leadership from countries on the continent to make this happen. And Africa has led the way. In the 2000s, there was a stage where global solidarity played a pivotal role. It was the time of the creation of the Global Fund, of PEPFAR, and combined efforts of multiple countries, platforms like UNAIDS and others, initiatives, communities and civil society, partnership that came together bringing science to the people that needed it. And what resulted were tremendous gains. That context also made the HIV response be the one development or health fields most funded by donor grants, to the point that in 2024, still 2/3 of the HIV response in sub-Saharan Africa remained funded by partners, all coming together. And this was in 2024. Today, we can say that sustainability and sovereignty in health and HIV are not necessarily aspirations, but they're realities. We have to come together to ensure that the gains are sustained and that there truly is a sovereign path forward. The pathway towards self-reliance, stronger country leadership, and a response that is sustainable in African terms must be walked now and requires immediate action and investment. It requires robust planning for integration and impact, and good and predictable partnering with donors and others as broader contributions decline. We also cannot be agnostic to the reality that the donor landscape has shifted, and it will continue to shift. We have seen that across multiple countries, development assistance has dropped between 10% and over 50% in 2025. These are historic declines. And we know that these declines will continue to head in this direction. And so what does this mean as we move forward? Africa, has through the years achieved remarkable progress, as I noted. Africa has managed to find a way to bridge a hybrid model of domestic funding and international funding. Let's not forget that the largest amount of funding in the HIV response is through African leadership. Africa has also balanced vertical and integrated systems. This has always been the case of the HIV response. And what we have seen over time is remarkable progress. New HIV infections declining by 58%, AIDS-related deaths by 61% between 2010 and 2025. But we also must acknowledge the reality as we move forward, that 26.5 million people are living with HIV in Africa and must be sustained on treatment. We must also remember that 4.6 million people in Africa are still not receiving treatment. This is therefore not a moment to lower ambition. We must lean in on what works, redesign institutions, reinvigorate those partnerships so that we can finish the job. It's important that we keep a focus on what will bring real impact in this phase. While the change in the architecture is capturing a large amount of attention in this stage, as UNAIDS, we acknowledge the relevance of the shifts, but it's not the architecture that will define success, but a wide range of elements. It's all about leadership. Let me start from a different point. The most critical transformation is actually sovereignty and country leadership in the full design of the national HIV programs, or better, of an integrated HIV program in collaboration with communities and partners. That sovereignty must come alongside self-reliance, a plan to ensure the response can be financially and programmatically sustained into the future. Country leadership covers a wide range of aspects, from advancing research and development, building procurement and pooled procurement effective systems. But it also requires securing an institutionalization of epi and financial data collection and generation of autonomous response and a peer learning approach. And so I want to focus just briefly on 5 key points. First, we must remember that global health architecture is not an end in itself. Its value is measured by whether political attention, finance, science, and accountability actually reach the people. In order, strengthening country capacity and systems is the most relevant. Ensuring peer learning and a marketplace of reforms comes next. And securing that global health architecture enables and supports technically and financial reforms is absolutely critical. We need a combination of strong government, strong regional and sub-regional platforms, like from the Africa CDC, from AUDA NAPAD, from the AMA, and other regional economic communities. We also need a partnership that brings community and civil society into the fore. Second, African leadership must shape the design and hold the pen and lead the reforms in terms of standards that are sustainable. From African country governments to from African academic and scientific institutions, regional and sub-regional platforms, local private sector, and of course, communities and civil society. It is this combination of actors that has led to the progress we've seen in the HIV response, and we need to maintain that kind of partnership from African leadership as we move into the future. Third, a new financing compact for HIV and other disease. We need this, and we need it fast. The old model of rather scarce domestic financing and abundant grants from donors is no longer the future. We must ensure increased domestic revenues and allocation, sustained global solidarity, even if it is at lower levels, and a wide range of diversified financing through bold mechanisms. And so the conversation needs to move there. Fourth, we must get serious about integration. That means building and consolidating gains that we have had, universal primary healthcare platforms that serve all people and respond to all diseases. Health systems that put people, not diseases, at the center. And we must ensure that the quality that we've seen in the HIV response is not diminished as we think about integration. And finally, let me just briefly note about UNAIDS as we are evolving in the whole global health architecture as well. We really must work together to protect the HIV mandate and the functions that the world, specifically Africa, require of UNAIDS, need of UNAIDS as transition continues. And this really is around data and accountability. It is around community leadership. It's about convening at various levels to ensure that HIV does not fall off the radar, and that there is continued political momentum, like we've seen recently in the high-level meeting on HIV and AIDS and the delivery of the political declaration on HIV and AIDS, that really must move from commitment to implementation now. And so let me close by saying that, as you know, many of us are moving from here into the AIDS conference that's coming just around the corner. Africa should carry a clear message as we move here into the future. Africa has always been leaders in the HIV response. Africa must remain the lead in the HIV response. We must be ready to invest more. We must be ready to reform systems and build regional and local solutions. And we must continue to move together because the job hasn't finished. Global solidarity cannot end before AIDS does. And so ultimately, again, just as the global future health architecture shifts, we must remember that we'll not be judged by how elegant it looks on paper. It'll ultimately be judged by whether a young woman can prevent HIV, or a child can start treatment, or a community can speak truth to power, or a country can ultimately sustain that progress without leaving anyone behind. So with that, I just want to thank you for the opportunity to be here and really look forward to the discussion today. Thanks. Back over to you, Florence.
Thank you so much, Angeli, for those insightful reflections. I've taken so many notes. I believe everyone else has. Please share your questions, your comments. I already see someone is asking for your 5 key points on the chat. If someone is able to share that, please do that on the chat or on the chat for everyone to see. I like how you told us where we've come from, where we are at, and you also shared all the rich science infrastructure that Africa has for HIV, for infectious diseases, that can be useful for getting us forward, and also reminded us of the need to strengthen integration and people-centered primary healthcare. Your remarks have highlighted that the future of HIV response will not only be on how the global health architecture evolves or looks like on paper, but also how countries and partners respond to these changes through stronger leadership and collaboration. I like particularly the quote, "Global solidarity cannot end before AIDS does." But this stronger collaboration and leadership needs to also bring in people living with and impacted by HIV and communities in the collaboration and investment. Thank you so much for your interventions. So this naturally brings us to the next critical questions. Dear colleagues, what will finance the next chapter of the HIV response in Africa? As traditional funding models evolve and countries seek to protect hard-won gains, there is growing recognition that sustainable HIV programs will require stronger domestic investment, innovative financing mechanisms, and broader engagements from both public and private sectors. So our next speaker will help us explore these opportunities through the perspective on charting the future of HIV investment in Africa. Brendan Kwesiga, thank you for joining us, brings extensive experience in health economics and financing, and will examine how Africa can mobilize sustainable investments for the HIV response. Drawing on experiences from across the continent, he will explore innovative financing approaches, the role of private capital and philanthropy, and the partnership needed to ensure that scientific advances and new prevention tools are matched by sustainable financing. Welcome, Brendan.
Thanks very much. Thanks very much, Florence. And it's great being part of this conversation and picking on from where Angeli stopped. I just need to confirm that my slides are visible on your side, Florence.
It is just not in your slideshow mode so we can see your next slide, but I don't think it should be a problem. Please go ahead.
Oh, sorry. Let me reset for, I think I can leave it as that if that's fine.
Yeah, please go ahead.
Yeah, thanks very much. And again, pleasure being part of this important conversation to shape how financing will look like for the next generation of HIV responses. I think it's important that I pick on from where the previous speaker stopped in terms of how the future looks like. To frame the conversation, I will emphasize three things in this presentation. So first is that the change is structural and potentially permanent. So we need to, as you saw in the Menti, country ownership is a must. The second big point is that the anchor for which everything is to be built is public finance. So we can never have a conversation about the future without strengthening the foundation. So public finance will be the foundation on which we build. And last is that there are options, yes. There are tools, yes. But these need to be designed to solve specific problems. So with that framing, I'd like to take you to the next slide, which talks to the outlines. I'll talk to the context. I'll talk about the anchor that I did mention. Then we explore through the toolbox of options with emphasis that these need to be led from what problem are we trying to solve. We state the preconditions, what needs to be in place, and then we package our message as we move into IAS 2026. So in terms of the context, and I know all the speakers that have spoken so far have emphasized a lot of this. There's lots of financing shocks happening in terms of change on the OD architecture, in terms of debt service, in terms of global and regional shocks around conflict, climate, and disease outbreaks. So that is not new. In this context of shocks, we also know that the cost of inaction is not just high, but is irreversible. What may not be visible in the numbers of what can happen if we don't take action, the risks around equity, who is most at risk. So for instance, we know prevention, we know community initiatives, we know children and other vulnerable groups in the society are more at risk if no action is taken. But we also know that it's been proven over and over again that the return on investment is high. So these three arguments are an important place for us to start as we think through how do we frame the future of financing for HIV. Now, I did emphasize that we have a foundation for which we should start on. First, there's no sustainability without domestic financing, but also we have demonstrated in the early days through the Abuja Declaration, but also as countries have been implementing that countries are able to do something. African countries have demonstrated that they're able to finance, and as Angeli mentioned, there's significant momentum that countries have taken in terms of contributing to financing. Even in the reaction to the ODA cuts, across many of the countries in the region, we saw many actions being taken, especially around increasing domestic resources. But in this foundation of public finance, there's some practical agenda that we need to carry that we know should strengthen this foundation on which other financing instruments can be built. So first, I need to emphasize the need to protect and grow the allocation. This is born of the realization of the fiscal context in which countries are in. Most countries are having challenges with growing economy, even in the context of competing priorities. So not only do we need to grow, but also need to protect what we already have. And there are some tried and tested tools in some of the countries, but also different country contexts may require different approaches to try and protect. The other practical agenda for strengthening our foundation, I'm emphasizing public finance as a foundation, is that we need to treat efficiency and cost savings as a must. So it is not an afterthought, it is a must. As we think through what we are doing, yes, is it effective? Can it be done efficiently? The other big component around strengthening our foundation is integration of funds flow. So there's so many discussions right now around integration. At service delivery level, interestingly, a lot of integration had already happened. What was causing fragmentation was around how funds were flowing. And in a number of our countries in the region, this conversation around integration first by ensuring funds flow through the public finance systems, but also increasingly for the countries with mature and growing insurance schemes, expanding or integrating packages for people living with HIV is a discussion that is ongoing. Lastly, on the public finance or on the foundation is also the making the systems work better from allocation, execution, oversight, because we usually have one unsaid word in whatever conversation we have around public finance in Africa, around leakages due to corruption, leakages due to embezzlement, and some of those arise from challenges with how our systems are designed, including also components around how our systems for collection are designed. So I know as part of the sovereignty agenda and design of the financing architecture globally, there's a discussion around flows, tax inflows. So although I'm framing it from the budget and expenditure side, we know that also the inflows are an important point. So having talked to the foundation, now we'll talk a bit to the tools or the options. And as I did start at the beginning, it is important to frame the conversation from what problem are we trying to solve. In the world of finance, there's a lot of innovation, but if the innovation is not led from how we are thinking in terms of the health objectives we want, in terms of how we are trying to shape the HIV response, then we'll be sidetracked. We'll be excited by big quantities of money, or what in the language we call the deal volumes, but not achieve the response objectives. So as we review tools and options and suggestions of how financing can be done in the context of the Africa's response moving forward, we need to examine the options raised on whether it is able to raise new money, on whether it is able to ensure that spending is more effective, on whether it is able to make capital cheaper or make capital flow in areas where it was not intending to flow, on whether there's a transfer of risk, especially to ensure that those who are not willing to invest under the high-risk conditions are able to invest, or even transfer risk around service delivery and other aspects. So based on this categorization and for framing of the conversation, I try to group tools into three categories for our conversation today. So the first one, we'll look at some of the options around raising more money. The other is around potentially increasing budget space within the existing resources, but also making capital cheaper. And the last is improving effectiveness and risk sharing. So quickly with regards to raising new money, I think the important points that we all make, and I was happy that in the response to the Menti, although financing was raised as an issue, no one said more money. Because most of us usually want to solve this current challenge we are in as an accounting problem. So the transitions that are happening are not an accounting problem where I've created a gap and want to fill the gap with additional money. It is a structural problem which needs to be shaped by both adding more money, but also ensuring that we structure based how that money flows to ensure that it is contributing both to programmatic sustainability, but also sustaining and increasing the coverage we have gained. So there have been some options around earmarking and solidarity levies. So basically dedicated streams that are ring-fenced for health and HIV. However, these are not necessarily most favorable for ministries of finance because they take away their work. Their job really is around appropriation, but also being responsive. But we have examples in Zimbabwe. We all know the AIDS levy in Zimbabwe. We know that Ghana's insurance scheme is funded through levy on VAT. And the positive around this, because for most of these tools, as I did mention, there are tests on which subject them. But in the context of thinking about the future, one of the key risks that we know is first of all, scale, but also equity. Like, how is this funding stream able to be scalable, but also is it able to ensure that services and interventions reach those that most need them? So with earmarking, because it is built on public funds, there's a progress, and most of them are designed progressively. They're able to enhance equity and also usually scalable. There's also an option around philanthropic capital and diaspora capital, and there's initiatives trying to bring this and direct it to the health sector. However, capital is not blind. Capital usually flows where it is wanted or where it is attracted, where it can get a bigger reward. Now, that usually, of course, poses an equity risk because, for instance, even if you're designing, let's say, service delivery facility, you usually want to go as an investor where you're able to get your return quicker. So with this philanthropic and private capital, the issue basically is around how to ensure that we design it so that it flows where we intend it to flow. And that's where some de-risking mechanisms may be useful. On the other group is potential options around increasing budget space and making the resources we have do more. So as I did mention in the context slide, there's high debt distress in most of our countries. So there's been innovations around debt swaps and debt buy downs, where debt is either cancelled or restructured to ensure that it's directed to financing health responses, including HIV. I know Global Fund is having conversations with countries around this, and this is able to, it scores highly on both our equity and scale parameters, and is an option that is especially potentially important in the current context within which most of African countries are. There's a lots of instruments, especially around making the resources we have do more than they can do currently. So market shaping through guarantees, food procurement, and instruments to shape how procurement financing is currently done. And again, with these, we see a big opportunity around both equity and scale, but also potential emphasis that for some of these cost savings achieved through these instruments to be achieved, to be realized within the programs, the PFM systems have to ensure that those savings are retained and directed within the health sector, which is an important conversation that is usually tricky for most of the countries. So in the context of HIV, we know we have gained from volume guarantees before. There are match fund mechanisms, including even supplier match funds, which could incentivize domestic production. There are pre-financing mechanisms, again, that tend to try and smoothen commodity flows. I know for other essential commodities, these have been useful and may potentially become useful also for procurement for HIV prevention and treatment, if increasingly we'll be using domestic resources, because if there are weaknesses in the public finance system, then at times you have cash flow delays, and this may be useful. They also propose African vehicles, and I know I've seen eminent colleagues like Dr. Sidibe, who could be knowing about the African Development Bank's African Medicines and Equipment Facility. The other week we were in Harare, SADC is setting up a food procurement mechanism. So all these are options that could be used for the future. The last group, and I know the timekeepers are catching me, the last group is basically meant to address the challenge of delivery risk, but also shape capital flows in areas where, again, it may not be able to flow if it is because of the risk. So there are outcome-based financing instruments such as development impact bonds and social impact bonds. The difference, so development impact bonds are usually funded by development partners, but social impact bonds have been funded by governments. And we have had pilots for both. I know there was a pilot for social impact bond in South Africa, and Kenya is currently implementing, I think, has scaled the development impact bond for adolescent and sexual reproductive health, including some HIV-related indicators. Again, these provide options. Equity can be designed within, although scale may be a challenge given the mechanics around ensuring that you pay for outcomes. So it has potential measurement challenges, and indicators have to be a bit clear. But there are advantages, of course, with some of the programmatic innovations, like in a Capoville, it makes prevention measurable at outcome level. So this would be a good opportunity. There's lots of set of tools around blended finance and public partnerships, again, which try to make conceptual capital both from grants and public to absorb the risk so that private investors can invest more in health. These will be very important, especially as we have the conversations around domestic manufacturing and other high capital investments that may be required as Africa moves towards the sovereignty agenda and owning the responses more. Now, all these tools are interesting, exciting, but something has to happen for them to work better. And to this, I talked to some of the preconditions that we need from governments, African institutions, and development partners. So for governments, it's important that we own early. I think, again, I emphasize that from what I saw in the Menti. So it's good to own early, build capacities, and also strengthen systems, especially legal and regulatory, that make these options feasible within our setting. It's already been mentioned that African institutions are heavy lifting already, and I'm sure the conversation in Accra this week will also be able to move some of these conversations we're having. For development partners, yes, the landscape has changed, but there's still some opportunities in terms of what we can do. So there could be an option on how we can better use the development capital we have now to better catalyze domestic investment, but also attract private capital. And that is an important role that you can play. Now, one of the challenges again is, for instance, investment in communities, which I know also Angeli had addressed. That's a conversation around how development partners can also work with governments to ensure that some of those interventions are prioritized. As I conclude, I think I have 5 points framed as a summary, but also potential actions and messages that we can carry as we move to the IAS 2026. So first, we need to acknowledge that this financing transition and the shifts and the shocks related with it as structural. And if no action is taken, many are at risk, especially the vulnerable. So that's why I keep emphasizing the equity risk. Domestic financing is the anchor on which we have to build everything. So none of these exciting innovations will work if domestic public finance systems and finances are not in place. Community-led and key population services must be financed by design, not as an afterthought. for these markets and these tools that I've talked to, most of them, as you can see, are shaped by markets, may not fully pick them on. So this will depend again on a well-financed and well-designed public primary healthcare system. I emphasize that we need to judge every instrument by the problem it solved and not by its fanciness or it being marketed. So you have to be clear on what problem do I have, what instruments make sense for me. And lastly, preconditions matter as much as the instruments. If your system is not set for the instrument to work, then it's a waste of time trying to implement, because you end up not having the gains from it and potentially losing even the little finances that you'd have used to in the more traditional approaches. So I'd like to stop there and look forward to the conversation as we ask questions and interrogate the presentation. Thanks.
Thank you so much, Brendan, for a very thorough presentation. I think I've learned a lot, and I believe many of us have. If there are any questions you may have, participants, please put your questions on the Q&A chat box or on the presentation chat box on Zoom, and we will get to them. I think I like how you started. Change is structural and potentially permanent. And I think that is how we must all begin to think. And also, I would like to add, change is painful, but we must sit in the pain if we really want to create change that lasts and is sustainable. I would like to thank you both, Brendan and Angeli, for starting us off very well. Together, your perspectives have highlighted that the future of HIV control in Africa will depend on two things. One, how the global HIV architecture continues to evolve, how multilateral institutions, partnerships, and countries adapt to the changing global landscape. And number two, how Africa mobilizes financing, investment, and partnerships needed to sustain progress, accelerate innovation, and ensure that countries increasingly lead and own their HIV responses. I'd like to just bring us, the three of us, together in a moderated conversation. And I will just start with some questions for both of you. And if there are questions, please, colleagues on the back end, alert me and I will get to them. But I will start with you both in just a broad question, and I will start with you, Angeli. We know we are experiencing significant transition at the moment, and you all are in the heart of it and leading in this way. From your perspectives, what do you see as the single greatest opportunity for Africa over the next 5 years?
Thanks, Florence. And I really have to say, I really appreciated your presentation, Brendan. I think it was a really nice compliment. So to answer your question and to keep it really succinct, look, change is happening. We're not going to stop it. It's going to keep going. So what I think the single greatest opportunity is right now is all about how leadership steps in to the change. It is all about leadership, African leadership, government, civil society coming in to define what the future looks like, to design what the future looks like, and deliver what the future looks like. And so that's a very broad response, but I feel like change is going to happen. The space is opening up. Let's step in. Africa leadership needs to step in, and this is the moment.
Indeed, Africa leadership needs to step in, and this is the moment. Brendan, what do you think is the largest opportunity?
So, thanks. I think first agreeing with Angeli in terms of the framing and from the financing perspective especially, we have seen the African leadership meeting declaration as a driving force. We know even with Abuja, and people usually cry about not having achieved Abuja, but you know that Abuja, the momentum it was able to give to the countries. And we know with these Africa leadership declarations, first, there's been country buy-in and countries demonstrating action in terms of moving that. But beyond the declarations, in the current wave and drive around African health sovereignty, the institutions have been developed and they are taking shape to drive the change. So it's no longer just declarations; the institutions drive the change. And now the opportunity we have is how to then bring all that together and drive country action. So importance around leadership, institutions, and then driving commitment at country level. I think that's the opportunity I see in the current context.
I agree, and I think I might add framing what the problem statement is. I think for a long time we have allowed the framing to happen externally and then implement what's framed. So that leadership must frame what the problem statement is for Africa, but also, I believe, celebrate the leadership that currently exists. It was very, very active and vibrant and quick on its feet during COVID, and even last year during the disruptions with the HIV response. And I don't think there's enough mention of that leadership in existence and what it is currently doing and making that visible. We see it with our people living with HIV networks, working with their governments to do all of the work that they have done to ensure treatment is sustained and people are assured of government's interest and in keeping people on treatment and keeping the HIV program going. Okay, so my second question is to you, Angeli, and I think it's to something you sort of spoke to in your speech right now on the role of UNAIDS. And I'm sitting here as a community representative and understanding that some of the actual lack of funding to communities and the direction of where communities need to go and what communities do would not exist if UNAIDS did not exist. As countries assume greater ownership of the HIV response, what role do you see UNAIDS playing in supporting governments through this transition while ensuring no one is left behind? Brendan spoke of the risks of inaction being the risk of inequalities for communities, for children, for prevention. How does UNAIDS help to support that this is equally important in this transition?
Thanks, Florence. I really appreciate the question, and I'll reflect on it in a few ways. I think, or maybe just note three specific things. I think one is data. I think one of the most important things as we all move toward sustaining the HIV response is how important data and all aspects of data. I don't mean just epidemiologic data. I mean financial data. I mean policy data. I mean legal infrastructure data. Data must always guide what we do in the future, because ultimately we want to make sure that every investment that is made has the greatest impact. And so UNAIDS can continue to play a role, as we always have, in helping to provide community data, helping to provide health sector data, helping to provide financial data to guide the response. The second is in sustainability planning and operationalization. You know, you referenced, and we all know, you know, the how difficult the abrupt changes were in 2025 and how quickly governments stepped in, especially in Africa, from February 2025 to quickly move and focus their resources to ensure continuity of services. That sustainability planning took into effect. You know, it was planning that had happened, you know, months, years ago, that now was quickly going into effect. And so I think that's another place. And the final area is really precisely on the critical role of communities, civil society, and community-led organizations. Sustainability of the HIV response will not be possible without community leadership, community designing, delivering, monitoring, being a part of the response as it moves forward. And so UNAIDS, with our joint program, with all the co-sponsors involved, we have a unique role in that we are always centering communities and community leadership and finding ways to bridge that gap between governments and civil society and pushing and ensuring that community leadership is not just prioritized but resourced and part of the planning table and the design table. So you can count on us, Florence. GMP Plus is an incredible global network, and there are many others around the world and around the continent. And count on us to continue to advocate and support civil society and community organizations as we move into the future. Thanks.
Thank you so much. And I believe the many community representatives on this call are reassured by yes, we will count on you. And I think I want to also show how your support, particularly for community data, like the People Living with HIV Stigma Index and community-led monitoring, have really been institutionalized because of your steadfast support and working with our governments to make sure that they're institutionalized, both in the GAM and then within government infrastructure and then funding through Global Fund and others. And I think this has helped to put people living with and affected by HIV's experiences into a format for decision making. And this is a very good example of what your support would look like across government into public health, but also with communities. There's a question from the chat for you, Brendan, but before I ask it to you, I want to just check in. You talked a bit about new prevention tools and scientific advances that are creating unprecedented opportunities. I must admit, from the People Living with HIV side, we are very excited at the opportunities in the pipeline for long-acting treatment, which we believe will really help a lot for many people who are struggling with adherence. But they also raise important financial questions. How can African countries mobilize the investment needed to ensure these innovations reach people who need them most? Because usually then the innovation is there, but not everyone gets to access it.
Thanks very much, Florence. And again, an important question. First, for most of these innovations, for sure, programmatically we're able to demonstrate their effect. And I know we have gone a bit further also to show, for instance, again, with the capability, there's a high return on investment as a starting point for the conversation. Now, what we need to do to ensure that the initially scary financial conversation is brought home to our leadership is linking it with other current agendas. So for instance, I know you may have heard of the conversation in South Africa right now around them being able to do some local manufacturing linked with lenacapavir. That's an opportunity that is able to potentially lead to reducing the cost of access for most of the population, but also is linked with a big agenda around local ownership, creating jobs, because the agenda is bigger than health, but health contributes significantly to it. So while we know that innovation is expensive, we know that that expense is cheap because it saves you much more for the future. So whenever we package numbers around this is a return on investment, and we show you that in future, if you address this problem now, then in future you won't have to incur that. That usually is a starting conversation. But if we are able to link that easily with also the other important agendas around manufacturing and how the countries can build their resilience through manufacturing on their own, that becomes important. There's also innovations countries are doing, and as regional blocks, for instance, doing food procurement, it helps you to be able to access these innovations at a cheaper price. I also talk to procurement guarantees. So having realized that the innovations are there, it's then now noticing how can we make it accessible to people. So pricing is just one of the conversations. Usually at times we think about the supply side before fixing how the demand is organized. And I think that's the conversation Angela was talking about communities. How do the communities work? How do we ensure that the supplies that we have available are able to reach those who need them? So there's instrument design around how we can work towards lowering prices, and I'm sure there are so many lessons that we learned from access to RT. And in my other world, I know they used to give it to me as an example when we were discussing, for instance, pricing for some of the vaccines. So there is lessons we have picked from before in terms of ensuring that all the innovations can be accessed, but also the opportunity I did mention earlier around now having institutions with regional mandate and able to take regional action. I think it's one of the important opportunities that we are able to take to ensure that all these innovations are able to reach those who need them most. So sorting the supply side, but also ensuring that demand side is ready to take it on, so that you don't waste after having managed the price of access. Thank you.
Thank you so much. And I think indeed demand creation, particularly from the community side, will need to take on a little bit of investment also in market shaping and market access research and feedback loops to ensure that reach is maintained. Okay, so to the question that you have on chat, just quickly, on sequencing, your point 5 in the conclusion, in the preconditions, you list deal structuring, capacity, outcome measurement, investable pipelines. These take years to build while the financing transition is already underway. Do you see instruments as something to hold back until the preconditions are in place, or as the vehicle through which countries build that capacity? What have you seen work?
Thanks very much. And it's a good question that allows me to reemphasize what I was presenting. So first, as I did mention, these instruments are built on a foundation, and that foundation is a working public finance management system. So having that foundation working in the first place is one of the important preconditions. And that needs to work even before you think about structuring any or developing any instruments. Now, that said, and talking to from some experience in one of the slides I talked about impact bonds. I know, for instance, in Kenya, what we did then, it was part of the SDG partnership platform and the group and UN partners, is even in the design, you inbuild learning so that you identify the capacities that you have to strengthen. So if you see that the instrument is suitable to address the problem that you have at the moment, you don't necessarily wait for perfection, but you inbuild structures to ensure that you are able to address some of those gaps. Now, the gaps, of course, if you don't have bare capacities, and bare capacities, I mean functional data systems, because you can't measure results if you don't have data systems, then probably you need to wait. You need to first make the basics work. But if you have some of the basics working, then there's an opportunity to then build as you run, noting that, again, there needs to be clarity around what problem you're trying to solve, so that you don't, so the instrument does not come ahead of the thought of what problem am I trying to solve. But the hope I'm giving is basically there's still an opportunity to build as you learn. And as I was talking, some of the instruments, for instance, which need structuring, they are not scale instruments. You don't do them at scale. So there's an opportunity that you can learn from having done in a given setting, and then with improved, for instance, measurement systems or verification systems, then you could be able to scale. Of course, lack of capacity is not a word we use a lot, because capacity there just needs to be strengthened, needs to be expanded. But in most of the conversations you get in around structuring, because still design of these instruments was not something that was being done routinely. It's still not a capacity that is very common within our settings, and development finance within the health sector is not yet very taken up. I'm sure most of our countries now have interesting designs, financing designs for roads, for infrastructure, but for health service delivery and health innovations, it's not something that is fully grown. So while I'm saying that we can learn as we develop, we also need to acknowledge that there's a capacity challenge that we can work with as we strengthen our systems moving forward.
Thank you so much, Brendan. And also to acknowledge that transition is not an end, it's a journey. You move, you learn, you come back. I mean, that's why it's a season and a period. And to put that in mind, even as we are working now and funding and planning, that along the way there has to be flexibility of, 2 steps forward, 3 steps back, and the resilience through that. I want to thank you both, Angeli and Brendan. You have really given us a lot to learn from and think about and be motivated by as we think ahead. We've explored the evolving global health architecture, the future of financing, and the leadership needed to sustain progress. And I'm really honored to have had this conversation with you. Thank you to you for all that you do and for joining us today and sharing your perspectives with us. Thank you so much. So, colleagues on the call, we would like to transition to the next part of our discussion, which is the leadership conversation. And we are excited to have with us Dr. Angeli Sidibe. Sorry, Dr. Michelle Sidibe.
Don't worry.
Sorry about that. Who's the former executive director of UNAIDS and the Undersecretary General of the UN, and Dr. Alex Coutinho, the director of Kofi Annan Global Health Leadership Program, member of the Africa HIV Control Working Group. We have explored with the previous speakers how the global HIV architecture is changing, and we have discussed the financing and partnerships that will shape the next phase of the response. So we are concluding this webinar by looking beyond the immediate challenges and asking what kind of leadership Africa needs to sustain and ultimately end AIDS. So the leadership discussion we are having now with Dr. Sidibe and Dr. Alex will take us into that conversation. So, Dr. Sidibe, I will start with you. And I must say that it's such an honor to speak to you now. I remember my first role as an advocacy officer in the Kenya Network of People Living with HIV office, working with your picture and I think it was Eric Gusby and the then president of Nigeria to tell women about EMTCT, which was just launched out of the 2011 high-level meeting. I remember those days with fondness because it was when I was really starting my country advocacy. So it's an honor to speak to you today. So Dr. Sidibe, you've led the global HIV response through periods of extraordinary change as multilateral institutions evolve and development financing shifts. What must Africa do to ensure that country ownership becomes more than an aspiration?
Thank you very much, Florence. Let me start by just saying that it is an honor and privilege for me to be with you and to have Alex as a co-panelist on this leadership discussion. First, it is timely and topical. The issues you have been picking, and I was following the discussion from Angeli and Brendan, very well articulated discussion. But your question is mainly around confidence. Really confidence that Africa can shape through his leadership the next chapter. So what gives me confidence is experience. For 40 years, we faced, and you have been on some of those part of the journey, every prediction that Africa could not succeed. And we faced them. We have been proving them wrong. So for me, yet together, we have been able to build one of the greatest public health achievements in history. People can say whatever they want. Today, Africa has something it did not have 30 years ago. And I want to strengthen stronger institutions, scientific excellence, community leadership, one of the best in the world, political experience, and above all, confidence in our own capacity. And I'm seeing that everywhere when I am traveling. The future of HIV is no longer being decided by the virus, like our time. It is being decided by politics, and we have to say, by economics and our willingness to lead. That is why I believe personally the next chapter will not simply be implemented in Africa. It will be shaped by Africa. And that's what I wanted really to say to respond to your first question. But it is so important that we remember those points, that we came from far, but we build institutions, we build community leadership. We have been able to transform completely the face. We have been breaking this conspiracy of silence around this. We have been changing completely the delivery system. So it's not like if we are coming from nowhere. We have to be confident, and I am confident.
I am inspired by your confidence, and I believe in everything you just said now. We have come from far. We have built incredible things with very little and under some strenuous environments, and we have and continue to do great work. I think we've also built some of the strongest pathways, task shifting between health facility to community. So all of that you said, and what we need now is the willingness to lead. Thank you so much. Dr. Alex, you've spent much of your career working to strengthen health systems and improve service delivery. How can countries sustain HIV gains while also building stronger, more integrated health systems that respond to broader population needs?
Thank you very much. And thank you to everyone on this call, particularly my elder brother, Michel, who continues to inspire me. Let me first give a broader answer and then narrow down to your question. Like Michel, I want to emphasize that Africa today is not where it was. The past has taught us that, for instance, we can roll out antiretroviral therapy to millions and millions of Africans, even when there was skepticism that we could tell time and know what to do. The past has also taught us that we could endure, survive, and even thrive during the COVID pandemic, even though we were told that Africans were going to die in the millions. None of that happened. But the present tells us that Africa is taking charge of its response, not just strategically, but financing as well as delivery. The present tells us that the geopolitical changes we're encountering are going to isolate Africa even more. But perhaps in that isolation, there is that opportunity to get the sovereignty we desire. The future is definitely going to be challenging, but Africa will endure if we have the political and technocratic commitment together, not just political, but technocratic, as well as the passion not just to deliver HIV services, but as part of a comprehensive package of health services, and in my view, embedded in primary health care, universal health coverage, and driven by equity. But to also make sure that the future is secure, we need to understand that health is everybody's business, and that government, civil society, private sector, and most importantly, the broader population and community have to come together and work together in synergy. Now, to your specific question, what are some of the specifics? First is that countries need to recognize that the appropriate health system for Africa is always going to be government-led, cannot be private-led, but that the best health system incorporates an all-of-society approach, including the private sector, civil society, and communities. Universal health coverage, we talk about it. We've heard how Ghana and other countries are driving universal health coverage. This is now becoming even more urgent, as is strengthened primary health care as platforms for HIV service delivery. The donor landscape will continue to be an important part of the future, but Africa needs to ask very hard questions. Are our donors efficient? We often talk about efficiency of Africans and our governments, but what about the donor funding and the institutions? Whether it be bilateral MOUs or the Global Fund, how do we ensure that we reduce the unit costs of HIV prevention or treatment and make them affordable for African countries? Have we maxed out the efficiencies? Can we eliminate layers that cumulatively take overheads that can often reach 50% of the donation? So, countries in service delivery need to, and countries and especially governments need to recognize that they need to work with partners who can reach the people that government cannot or chooses not to. The right to health supersedes politics. It supersedes religious and cultural concerns about sex and sexuality, and needs to recognize that life and health is about personal choices and circumstances. And finally, in particular, we need to recommit to HIV prevention, recognizing that an effective antiretroviral therapy program that achieves 95-95-95 is one of the most important HIV prevention pillars by suppressing the virus. Thank you.
I don't know about everyone on this call right now. It just feels like we're just starting and we are at the tail end. This is really, really innovative. And I think both of you bring something that is more important for me to summarize in this way. We have what it takes. We have done things in the hardest of times and proven many people wrong. We may find ourselves geopolitically excluded in many places, just as we have been most times, but we have it within us to lead. But we also have to accept two things, that we are the leaders who must be technical and be here to do it. We must challenge the status quo and be very forthright with what Africa needs for Africa. And sometimes that is what is more efficient, what is more accessible for many, because Africa also still has the population that has more people living with HIV. I just have one other question to ask both of you. We've highlighted in today's discussion financing, governance, and partnership as key and important. Which of these do you believe represent the greatest opportunity for transforming Africa's HIV response over the next decade, and why? And I might ask that Dr. Sidibe, you answer this from a more governance perspective, and Dr. Alex from a more implementation perspective when you take the questions. Over to you. I don't know who wants to start.
Thank you, Florence. I think we need really to come back to the centrality of the issue. From my point of view, the issue is around country ownership. That is the central part of what we need to think when we want to talk about this all development of financing shift or whatever is happening today, which would affect seriously all the gain we have been having and the transition we are talking about since the beginning of this meeting. For me, ownership begins with where dependency ends. It's very important to mention that. By mentioning that, we need to underline that ownership is not simply about financing. I am hearing people talking about financing. Financing is very important. For me, it is about leadership. Why is it about leadership? Because without proper leadership, you don't protect the human rights of the people. And a right of to health is the central part of what will make really ownership a reality. So it means for me that first, setting national priorities, building capable institutions, mobilizing domestic resource. I heard about data, using data, our data to drive decisions, and holding ourselves accountable for results. Because in reality, financing is not a technical issue, like Brendan said, or I don't know the word he used. It is about accountability for results. It is about accountability for right decision, and it is about accountability for fighting inequity, whatever it is. So if we don't have that one, it will be very difficult to have the shift we wanted. Countries must become, that is my analysis, the conveners of partnership, not simply the recipients of projects. And most of those projects are feel-good projects. They are here today, we are uploading, tomorrow they are not here. Community must remain at the center. Florence, anything we will do, which will not be done with the communities, will not be sustainable and will not be owned by ourselves. Because the HIV response, from my point of view, succeeded when citizens become a partner in shaping solutions. That was my experience in the past. And I don't think it will change. You go from Zimbabwe to Bamako, you will see today a new social domain. And this social citizen domain is to change the paradigm. And when I said changing the paradigm, is to not be anymore a simple recipient, is to be the central conveners of partners and making them understanding what is important for us and starting with that. And if you don't have a community in this part of the discussion, the whole ownership will become just, again, worse. Our ambition should not be simply to finance more. It should be, from my perspective, to decide more, to innovate more, and to lead more. And that's why, I want to say, let us not make a mistake. Our objective is not to say again, you know, we have a problem, we need you to help us. Our point today is to ask our political leaders, not people who are coming from abroad. They are very nice. I was part of this game for so long. But to make any response sustainable, it will start if we are capable to make our own leaders accountable to their own people. And that's what I wanted to add to what I said.
Thank you so much. Dr. Alex?
You know, Michelle and I are synergistic. So for me, it's not about financing or governance or partnerships. The key word is leadership.
Yeah.
Because the greatest need we have in Africa is committed and results-driven leadership, not leadership of just talking and appearing in meetings and talking, and you go away and do nothing. And you need leadership at all levels, from the head of state down to community leadership, focused on delivering results. It is results that will save the lives of our people. It is not necessarily all the talk. You see, leadership also drives, in addition to what Michelle has said, leadership drives resilience, adaptation, and change, which is what we need right now. Leadership ensures that there is synergy and a common vision and a common commitment. Leadership facilitates innovation, entrepreneurship, so that new ways of service delivery can be explored. But also, leadership will ensure that adaptation of digital technology happens to support and enhance service delivery. Leadership will ensure that there is knowledge uptake, and leadership will ensure there are systems to serve as the first warning signs that things are not going as planned, so that corrective measures can be taken in place. It all goes back to leadership.
Thank you so much to both of you for inspiring us this morning, afternoon, or evening, depending on where anyone is joining. I think we are leaving this webinar really inspired. Leadership is important, and leadership is what will take us. The centrality is country ownership. Ownership begins where dependency ends. And I want to think that that also is true for community-led organizations. And even as we are all transitioning funding mechanisms and systems that provide agency to governments and others, that must happen for community organizations like ours too, because ownership begins where dependency ends. Thank you, Dr. Sidibe and Dr. Alex. Your reflections remind us that the future of HIV control in Africa will not be defined by financing alone, nor by institutions alone. It will be shaped by leadership, by partnership, and by the choices we make today to strengthen country ownership, invest in resilient health systems, and place communities at the center of the response. The themes you have talked about today resonate throughout the webinar that have been organized by the Africa HIV Control Working Group and Policy Strategy team, who I want to thank so much. But I would like to finish with a little reflection of my own. I would like to challenge that if indeed the burden of HIV is in Africa, and the region is currently facing the most significant transitions largely impacted by the global health architecture reforms at this moment, then African leaders, including the leadership of people living with HIV and those most impacted by HIV, must be bold to frame what the problem statement is for Africa, and that our work must be led and framed from that leadership. We must define the mechanisms for solving our issues and our problems and our opportunities, including how we organize movements and advocacy. We must strengthen our collaboration with our government and regional leaders. We must have our Africa HIV epidemic response be boldly led by Africa, because we must demonstrate that we trust the leadership of Africa. We are the African leaders now, and it is our job to make this happen. Thank you so much. I would like to give the floor back to Joanne to quickly run the final Mentimeter poll. Just give us 2 minutes of your time to finalize this as we close this session. Thank you so much to all our speakers today.
Thank you, Florence.
Thank you. Thanks, Florence.
Thank you, everyone. We'll move to our next question. Sorry. And the question reads, which area should be the highest priority for sustaining Africa's HIV response over the next decade? Florence, do you want to read out the responses?
Yes, I see strengthening domestic financing shot up to 57%, integrating HIV to stronger health systems at 29%, and expanding Africa leadership and country ownership to 14%. I think we need to also still pump in the energy for promoting Africa leadership.
Thank you. I will move on to the next question in the interest of time. And the question reads, which action will have the greatest impact on the future of HIV control in Africa? I'm seeing we have a couple of responses. Let me show the responses. Florence?
Increase domestic financing has the largest bar, and then strengthen health systems, and then improve accountability and governance, and expand regional collaboration and partnerships at number 4.
Mm-hmm.
Is there another question?
Yes, there's a final question, which reads, what is the one action Africa should prioritize to secure the future of HIV control? Let's see which responses we have. Go ahead, Florence.
I do not see the responses, but I see...
Just read, these are the responses.
Okay, universal health for all, strengthen domestic resource mobilization for HIV. Africa should prioritize to secure the future of HIV control by strengthening and sustaining investment in comprehensive HIV prevention, testing and treatment, and care through resilient health systems. Increase financial local funds for HIV, integration of all operational practices from 40 years of investment in their own health systems to develop private-public partnership, increase funding for HIV locally, and building dedicated domestic HIV budget lines, regional pharmaceutical, generic manufacturing, folding all HIV services into primary health care.
All right, thank you. Those are all the questions that we had for the Menti.
Okay.
Yes, Florence.
Do I close, or is that to you?
Back to me, but before I close, I'd like to introduce, I'd like to bring in Dr. Alex Mumbi. Dr. Mumbi Chola, sorry. He'd like to highlight something. I'm just sharing it on my screen ahead of, even as we prepare for IAS 2026. Dr. Mumbi, can you hear me?
Yes, I can hear you. Hello, everyone. Thank you once again for joining our webinar series. For those that have been with us from the start, and for those that came in for the first time here, please do look out and go back and have a look at the discussions we had in the previous 3 webinars. You can check from either our website, AHCWG website, or the Policy Strategy Group's YouTube channel. We have all the recordings there, and we'll have this one up as well. And what we are sharing on the screen is a side event that we'll be co-hosting at IAS next week on Tuesday from 14 hours to 16 hours. It's looking at the shape of sovereignty, and we are looking at centering women's leadership in African health agendas. So please, if you will be at IAS, do attend this important discussion that will feature the Deputy Minister from South Africa, Mr. Joe Pala. We have the Honorable Minister of Health and Childcare, Dr. Douglas Mombeshora from Zimbabwe, as well as Dr. Moronike Okpum, renowned academician and community health champion from Nigeria. And we have our colleagues who are part of the working group who will be at who will be there at the side event, Ms. Yvette Raphael, as well as Ms. Chirifia Kasanda, who are both also world-renowned community health champions. So please do attend this webinar, and we look forward to seeing you there. Thank you.
Thank you so much, Dr. Mumbi. And yes, we can't wait to join the discussions there. Colleagues, we've come to the end of the webinar today, the last of the series that have been led by the Africa-led HIV Control Working Group. And on their behalf, I would like to extend our sincere thanks to all the speakers, all of you that joined us today, partners, interpreters, and all who have contributed to making this webinar successful. Thank you once again for joining us. We wish you continued success in your work, and we look forward to continuing these conversations as we work together towards a stronger, more resilient, and Africa-led HIV response. It's been an honor to moderate this session. Thank you so much. Goodbye.